In this series of videos, we will talk about the different landmarks for soft tissue structures, articular surfaces for joints, and other landmarks that are important for the configuration of different bones. Please note that each bone is presented in anatomical position. This is the sternum. It is made up of three different parts: the manubrium, the body, and the xiphoid process, which would be shown here. The manubrium contains two notches, the jugular notch and the clavicular notch. The clavicular notch is where the clavicle articulates with the sternum. This is the left clavicle. The clavicle contains three basic parts: the medial or sternal end, the body, and the lateral or acromial end. Along the clavicle starting at the sternum, there is a convex curve followed by a concave curve near the acromial end. The sternal end has an articular surface to articulate with the clavicular notch on the manubrium of the sternum. As you travel down the body of the clavicle, the superior surface will be smooth from end to end. The acromial end has a small flattened oval facet for articulation with the acromion process of the scapula. On the inferior view of the clavicle, the sternal end contains a rough surface impression for the attachment of the costoclavicular ligament. Inferiorly on the acromial end lies the conoid tubercle, where the conoid ligament attaches. You may notice that in anatomical position, this tubercle is located more posteriorly. Extending laterally from the conoid tubercle is a trapezoid line, which provides attachment for the trapezoid aspect of the corticoclavicular ligament. This is the dorsal surface of the right scapula. Here we have the axillary or lateral border, the vertebral or medial border, and the superior border. The top portion is the supraspinous fossa, and the bottom portion is the infraspinous fossa. The scapular spine divides these two fossae. The scapular spine leads to the acromion, which is a small oval facet that articulates with the clavicle for the acromioclavicular joint. This is the ventral surface of the scapula. This surface is the subscapular fossa. We can see the scapular notch and the coracoid process. From a lateral point of view, we can see the glenoid cavity, which articulates with the head of the humerus. Here, we can see the supraglenoid tubercle and the infraglenoid tubercle. This is an anterior view of the right humerus. The humerus contains three parts: the upper end, the body or shaft, and the lower end. This is the head of the humerus. Beneath the head is the anatomical neck. Here we have the greater tubercle and lesser tubercle, which is separated by the intertubercular groove. The surgical neck lies here as we transition into the body or shaft of the humerus. On the shaft contains the deltoid tuberosity, which is the attachment site for the deltoid muscle. The lateral side of the humerus has the radial groove, where the nerves course through. As we reach the lower end of the humerus, we find the medial supracondylar ridge and the lateral supracondylar ridge. The lower end of the humerus contains two epicondyles, one medial and one lateral. Anteriorly, we see the radial fossa and the coronoid fossa. The radial fossa lies proximal to the capitulum, and the coronoid fossa lies proximal to the trochlea. The capitulum and trochlea are the articular surfaces for the head of the radius and the trochlear notch of the ulna, respectively. Posteriorly, we have the olecranon fossa on the lower end of the humerus, which articulates with the olecranon process of the ulna when the arm is in full extension.